Welcome to Expert Profiles Atlanta, where Atlanta's influencers and innovators share strategies for overcoming obstacles and achieving success in business and life. Here's your host, best-selling author and Atlanta influencer, Neil Howe.
Hello and welcome to the show. This is your host, Neil Howe, and today my guest is Will Hall, who is the CEO of HIPnation. HIPnation helps anyone who is frustrated by the continuing rise in insurance costs, and that goes for individuals, families, and businesses. He can give everyone their own 24/7 physician dedicated to them and also cut their costs by 50%. HIPnation was started by 3 nationally recognized physicians who understood that to fix a broken system, you have to start in the exam room. And we are going to hear all about that from today's guest, Will Hall. Welcome to the show, Will.
Neil, thanks so much for having me. I really appreciate it.
Well, tell us a little bit about HIPnation and who it is designed to help.
Right. HIPnation was started by physicians taking care of patients in a broken system, and they felt like they had a better way. So it really is designed to help the patient, the consumer. We feel like a lot of the changes and a lot of the things that are being put into the system at a big level and not really taking interest of the consumer, the patient in mind. So the patient who sits in front of the physician is the one that's going to see the most help. Obviously, fantastic care, but that extends into families and businesses.
So what's the big problem? I mean, I know the healthcare issue has been talked about for many, many years, and it's just a huge market that's growing so quickly, but the expenses to the patient are growing so quickly as well. What real problems are we faced with now?
Well, that's true. It's an ever-increasing cost model because of the way the system is built. And unfortunately, the patients and consumer at the end level is the one that's bearing a huge brunt of that. There was an article that was released this past week about the drain on Medicare and the costs of the system continuing to go up. And there are about 2 sentences in the middle of this big article that over $400 million was being borne by the consumer. And so you have an entire article talking about that, Medicare is being drained by these rising costs, but those $400 million going to the consumer is a huge deal for the consumer. There was a recent article in, I believe it was USA Today, about insurance premiums for a family of 4, often more than their mortgage now.
That is crazy for something that is only there really for emergencies, and it's not something. It's almost better to not have insurance, but that's against the law as well. So, what's the solution here?
Well, Neil, you hit the nail right on the head. Insurance should be for emergencies. It should be for the big ticket, low frequency issues. Just like car insurance is for when you have an accident, not for your oil change. Health insurance should be very similar, and that's the best way the system could work. That's what our physicians started building several years ago, and that's what we built with HIPnation. So the solution is to remove insurance from about the 90% of healthcare where it shouldn't be, put it into that catastrophic space or big ticket surgery space, those kind of things. And then when you do that, prices go down, access goes up, people get healthier. The results of removing insurance out of that system are pretty astounding.
So how do you propose to do that across the board?
Well, we're starting in North Atlanta to build the model. We've been taking care of patients and businesses for about 15 months here. But what we do is we use direct primary care. Some people know it as concierge medicine as the foundation of all we do. So it's a membership model, and that not being insurance, the statistics are anywhere from 60 to 80% of your healthcare can be taken care of with your primary care physician. So we remove insurance from that. A member would pay $100 per month, join HIPnation, and they get 24/7 access to their primary care physician that works with HIPnation. There's never a copay to talk with those physicians. They're 24/7. We really do send an ID card to our members with their doctor's cell phone on it. And so that is now going to take care of 60+% of their health care. We've gone out and we found specialist physicians who love the model as well. So they support our primary care physicians and our members together. And then we've gone out to the market and we've partnered with a reinsurance company to build an insurance plan for really that 10% of accessing the hospital. So you drop the cost tremendously by only having insurance where it should be.
So talk to me about the 60%. You said that's taken care with $100 a month membership?
Right. $100 per month membership. What that does is that gets you access to the primary care physician. And interestingly, when you have that access and there's no barrier to care, meaning there's no copays, there's nothing like that, and there's no reason, you don't have to come see the doctor if you don't need to. They don't have to code something to get paid for it. So Neil, they can actually take care of 80 to 90% of your health care when you're a known patient to them and you have a relationship. 80 to 90% can be done over the phone when they do know you as a patient. So that dramatically changes that, that paradigm of having to, take time off from work, drive in traffic, sit in a waiting room, go see a physician, pay a copay, and all of those kind of things. Now we're removing that and we're saying, we're going to connect Neil to his primary care physician. And now the physician makes the decisions based on your healthcare, not based on a payer system.
Mm-hmm. And does this cover stuff like regular checkups as well?
Absolutely. We want you to have that physical. So, one of the things, as soon as members join, we send them an email and really encourage them. We'd like you to make your physical and your wellness appointment pretty quickly. It's going to be a drastically different appointment than what they're in most cases they're used to. In the U.S., the average appointment is about 8 or 9 minutes. And what we do, because we changed that model, your physical may be a 45-minute appointment or an hour appointment, whatever the physician needs to get to know you, get to know your goals, not just symptoms and not just being reactive, but proactive. What are your goals long term?
Yeah, it seems like that is something that the consumer would actually want as well. Nobody likes to sit in the waiting room for 30 minutes to an hour and then be seen for 3 or 4 minutes. It's like you're shuffling in and shoved out.
It is, and unfortunately, we don't like it as consumers. And I've had the privilege of getting to know our physicians who've joined HIPnation or are working with us over the last couple of years. They don't like the system either. Yeah. They went to medical school, committed years of their life, a lot of sleepless nights to be able to become physicians and want to serve and care for people. And unfortunately, they've gotten caught up in a system that, they become kind of the last person that gets thought about. And then, the last person after that's the patient. So I've just learned that the physicians don't like that system either. They really do want to take care of us. They want to serve their patients, take care of their patients, help them be healthy. And unfortunately, they're caught up in a system that just doesn't allow it.
Right. And of course, when, the system is clogged up like that, they can't afford to spend enough time with each patient. But if they can spend up to 45 minutes to really getting to know you and finding out everything that's, an issue with you and what your goals are, it's a lot easier to give advice over the phone.
Absolutely. We have a saying that the relationship changes everything. When you have a true relationship with your physician, just changes everything. And have, fantastic stories. It's so gratifying, both from our member side, but also our physician side of changing that paradigm. One of our physicians said, she said, I've rediscovered my joy in medicine. I've had more joy in 6 months practicing with HIPnation than in 15 years of medicine. Because you take out all of the administrative burden in the primary care office and let them really take care of patients. The statistics, Neil, are that for every 1 minute the patient is with the physician, that physician has to spend 2 minutes to go deal with all of the administrative burdens, related to the current third-party payer system. So we remove that and just ask our physicians take fantastic care of the patients. The patients love it because they say, we had someone jump at our Facebook page the other day and say, gosh, I just had my physical, my first appointment with my physician. She spent no time on data entry and looked at me and asked questions, how gratifying that was. Patients see the difference as well, and the physicians love it. They really, they're burnout cogs in this system as well.
Yeah, well, that's good. You don't want a burnt out physician. That's when mistakes can be made. So the more alert they are, and the more they know you, the better their service is going to be. So tell me about the emergency situations. What happens in that respect?
Well, the great thing is when you're connected to a 24/7 physician that is your physician, you're actually about 65% less likely to access an emergency room or an urgent care, because so many of those things can, again, be taken care of by the physician who knows you. And so now what you get is if you have a question about that, you're calling your physician and they're making the decision. You know what, Neil, I think you do need to go to the emergency room. But the stats are that if you're connected, they'll cut out about 65% of those visits. And let's say that you do have to go to the emergency room. That's where we've gone out and partnered with insurance products that really connect in that space. They don't do anything to change the way our doctors treat you. There's no burdensome regulations and documentation and things like that for our primary care physicians. The contract is with you and that insurance company. So that drastically lowers the costs, lowers the administrative burden. And then if you had to go to the hospital, emergency room, surgery, whatever it may be, or, something catastrophic, now you would have an insurance plan that should be in that space, and it's only touching your healthcare in that space.
Well, that definitely makes sense. Now, tell me how this is different from a company like Medicare that tries to, I guess they try and take everybody's medical bills and combine them, and they have a monthly service as well.
Yeah, interestingly enough, we have quite a few members who use Medicare as their catastrophic coverage. And so Medicare obviously is a sharing ministry. They pool everyone's dollars together to be able to pay out claims and those kind of things. And there are others as well. And so what we have is we have members that say, if I use HIPnation, I'll join HIPnation, I'll have 24/7 access to my primary care physician. So now I'm much less likely to need, downstream services and, on a bigger cost. So we have folks that are using Medicare. That's their catastrophic coverage for big things. And, you can buy up or down as far as whatever your out-of-pocket is. And then they pair HIPnation to make their full solution. So we have members doing that. We have members that are using a unique indemnity product that we've gone out to the market and found that really works well with us. The costs are, about 70% less than what's on the exchange for a family. And then when you pair that with HIPnation, you have a full solution. So an example in the Atlanta market, an exchange plan for a family may be $2,200 a month with a $7,000 deductible. So now you're talking huge money out of pocket. We pull that down to $1,000 a month and no deductible. So you have a family of four with $1,200 per month right back into the family budget. That's pretty transformational. That's a great story for a family.
It certainly is. I mean, that is huge savings. You're talking tens of thousands of dollars a year that you could possibly be saving if you actually have to use it and come out of pocket as well.
You got it.
That's a no-brainer. So, what are you doing at HIPnation to, get this word out? And are you in other areas outside of Atlanta?
Well, we're in North Atlanta for the moment. And, HIPnation, we plan to go national and really be a part of changing the healthcare conversation in this country. We really have a big goal to be able to do that. The story is just in, almost a year and a half of taking care of businesses and individuals and families are phenomenal. What you said on the savings, thousands of dollars a month is great. But the healthcare is phenomenal. And so that story, we want to replicate that across the country. Our physician founders are nationally known physicians. They've done a lot of speaking around the country. So we already have great energy in other states, saying, hey, bring the HIPnation model to us. We're ready to go. So our goal is really to build out around Atlanta. We should be opening several more clinics in the next couple of months. And then really going into the businesses. We're talking to lots of businesses about what we're doing, and then be able to go take it to other states. So that's certainly the plan. Appreciate folks like you helping us get the word out. That's certainly a part of what we're doing. Our chief medical officer spoke at the Roswell Rotary Club this week. We're speaking at different CEO forums next week.
So, Will, we have talked about the individuals and the families, but we haven't really talked about the businesses. What benefit is HIPnation for a business?
Well, that's exactly where the concept of the company came about. We started out as healthcare impact partners, and our physicians were consulting with businesses and trying to help them understand the complexities of the insurance system and what that was doing to businesses. So, businesses are averaging a double-digit increase on their insurance costs every year, and if you do a 10% increase per year in 7 years, you've doubled your cost. And businesses just can't continue to absorb that. So what they're doing, they're passing more and more on to the employees, higher deductibles and those kind of things. And, all the downstream negativity that comes from that. So our physicians were going to those businesses. So we took about a year to build a full solution for those businesses where we actually get them out of those double-digit increases per year, help them get a healthier workforce. It looks fantastic for the workforce that you go from a fully insured plan with a $40 copay that's a barrier to primary care, and now every single person in the organization has a concierge physician, and so that helps them get healthier. You decrease absenteeism. We have companies using it as a recruiting tool. And just give you an example, a 75-person company averaging a 10% increase per year came to us and said, we just cannot continue to do this. And we showed that company signing up with HIPnation a $400,000 savings in 4 years. That's right back into the company. That becomes, new equipment, raises for folks, opening a new store, all of the kind of things that are, growth oriented towards a company. But $400,000 back in the bottom line of a 75-person company it's a great story for a company. Transformational.
Yeah, it really is. I mean, that makes a tremendous difference. Now, talk to me about compliance, because, these companies have to have health insurance for all their employees. Do you have everything covered here in that respect?
We do. One of the founders is a healthcare attorney. And I joke that I know one person at least read the entire ACA, and that was our founding attorney, to build this in a way that was truly compliant for the businesses, made sure that we check all the boxes and make sure that we're helping protect their business. We're partnering with them in that way as well. And so we're taking care of individuals, businesses, families. We're compliant with the individual mandate. The penalty's still in place for 2018. So, we were able to help hundreds of folks in 2017 get out of that penalty, and we'll do the same thing in 2018. And, who knows what they'll do politically next year. But we built the entire system to be fully compliant with the insurance regulations that they need and all those kind of things. But, ultimately transform the system and change the way people think about it, because insurance and healthcare are two totally different things, and it just gets muddied in our current system.
Well, talking about the political system as well, I see that you got some backing from Herman Cain. He said, the system is something very unique that he hasn't seen for quite a long time. Tell me about that.
He's been just really fantastic for us. I think Herman Cain heard about us from one of our founders and wanted to hear a little bit more about the model. So we sat down with Herman over a couple of different times, walked him through the model. And, he sat there. We were talking about the example of that 75-person company. And that's what he said. He said, Will, imagine 20 companies in a county saving $400,000 in 4 years. You're talking about transforming an economy. And so he's just been fantastic for us. Herman's been on the scene around healthcare for 30 plus years, has seen a ton of things. And that's what he said is, I think this is the best solution. He's been fantastic to help us get the word out about what we're doing. And so been really good. He's got a megaphone and has been very gracious to use it for HIPnation.
That's right. So how quickly is this going to be able to spread into other cities and around the country and really make a difference? Like you said, I mean, in one county to have 20 businesses like that, that's going to make a major impact to not only the businesses, but the county as well. How quickly can this spread across the nation?
Well, you got it. We're doing it in Atlanta. It's already being done and being transformational. Our goal is to build out Atlanta through the rest of this year. And then farther into Georgia, we have already had conversations, other cities in Georgia as well, other physicians. And the next year, we will begin to go into adjacent states. Our physicians have great relationships across the country from really 10 years of speaking about the brokenness of the system. And so we have great plans to be in multiple states next year and already have physicians teed up who are ready to do what we're doing. And we feel like once the tide goes from a grassroots perspective, and we can have physicians and businesses in other states call our physicians back here, because the stories are great. It works. It's a no-brainer. We're saving folks a ton of money, but even better than that, they're getting amazing healthcare. The quality is fantastic.
Now, talking about stories, are there any stories that stand out? Any, sharing a personal story of somebody who's actually used the system really lets people know, what it could mean for them. Are there any personal stories that stand out to you?
Neil, there's so many, and it's been so gratifying for us, from the physician side. I talked with one of our physicians the other day, and he said, I love taking care of HIPnation patients. I tell them it's so fun to only have two of us in the exam room. And I said, well, what do you mean? And he says, well, in our insurance system, there's me and their patient, and there's an insurance company telling me what I can and can't do, and this isn't coded correctly, and all those kind of things. And so I hear I've got a 20 plus year physician, one of the top physicians in Atlanta, who's saying, I love taking care of HIPnation patients. It's transformed, brings joy back. And then from a patient perspective, I was talking to one of our members who's a type 1 diabetic. That's a very serious disease. And he was telling me, how much better his health is, how much more controlled his A1C is, just in 6 months with his primary care physician. And I pushed back a bit and said, gosh, you're a smart guy. Have you learned anything new? I mean, what's different? You've had diabetes. What is different? And he said, the relationship changes everything. I have a physician who cares about me, who asked my wife to come into the office, talk with the two of us about, what goals would be, how we needed to cook, said, here's a book. I want you to read this. I want you to start doing things differently. And then he said, and 4 or 5 days later, actually calls my wife to say, hey, how are things going? So when you hear that, you're really transforming. There's a family, there's a dad with 4 kids that his health is transformed within, 120 days, because now his blood sugars are under control and things like that. And, I mentioned earlier, one of the patients, jumping on Facebook and saying, had my first visit, and, my doctor was not doing any data entry the entire time. Just story after story is just fantastic. We've one of our physicians, here in Atlanta, we just, probably like the rest of the country, had just huge bouts of the flu. And, a few weekends ago, it was just really cresting. And one of our physicians, she was so excited, she kept 3 of our members, in 3 different families, out of the emergency room that weekend. And, and emergency rooms were overrun with folks with the flu, very, very serious, but they were able to call their physician. She was able to talk with them, ask them questions, and they'd be able to manage that outside of the emergency room, which is great for our members, our physicians getting to, use the skills that she's developed and the caring and the empathy. And, when you keep someone out of the emergency room, that's thousands of dollars that don't come out of their budget. So I could go on for an hour of story after story. It's been just really gratifying what we're seeing on multiple levels, and the business levels. When you can save a business $5,000 a month right back into the business, that's a difference maker for a business owner.
Yeah. Talk to me briefly about the fears that some of these people have, whether they are, a family trying to make sure that they have insurance, for the family, or whether you're a business trying to make sure that everybody's covered. Talk to me about the costs and what the fears that these people have, and, how HIPnation has alleviated that.
Well, Neil, the biggest fear is change. I had a great conversation with a group that had heard about what we were doing this morning, and they asked the same question. And I said, it's change. No one likes change, but we really have folks that are, as we say, kind of in a corner and have to do something differently. And so, there's an education process. When you hear the media and you read the newspaper and things like that, it's very muddied about insurance and healthcare. They use those interchangeably. So we help people understand that, healthcare is your doctor taking care of you. and insurance is how it gets paid for. And you don't need insurance to pay for a runny nose or for poison ivy, but unfortunately that's where our system is. So we really come alongside our members and potential members in an education process. That's what I was doing this morning, was sitting with a group and educating and walking them through, helping them understand that, not only from the financial aspect, but how the system works. And when you build a community that are coming around patients and advocating for our members at multiple levels, it really does work. So that's really the biggest fear, is it's a change. It's different. We only know insurance and high deductibles and those kind of things. And to talk about a different model that's been put together, people have some fear around that. And then obviously the big fear of, what if I do have something catastrophic? What if I do have cancer? And, we've put the systems in place that's really where insurance should be. And that's when you'll access insurance, is with the big things like that.
Well, it's definitely something that we need to get the word out about. So, anybody listening to this needs to go and share it and talk to their friends about it as well. But how do they find out more information about HIPnation and about you as well, Will?
Yeah, they can find us at HIPnation.com, HIPnation.com. And then HIPnation Healthcare is our Facebook. And so I'd love for folks to like it and share it and help us get the word out at the grassroots. And so people can start to see that and see the difference. That'd be fantastic. On our website, there's a contact us form, and we love to hear from people. We love to be a part of educating, answering all the questions, because we get, that folks only know kind of the system that's there, but that's broken. This is new and it's different, but hundreds and hundreds of stories of transformation, both on the healthcare side and the cost side from folks. Have really been fun. So check us out at HIPnation.com. If you have questions, contact us. That comes to us, and we'll have someone give you a call. We'd love to sit down if you're local and have a conversation, but love to jump on the phone as well to talk about what we're doing.
Excellent. Well, Will, you've definitely got a great plan, paying less for healthcare and for better healthcare as well. It sounds like a no-brainer. So go check that out at HIPnation.com. Will Hall, it's been a pleasure speaking with you today. Thank you for being my guest on Expert Profiles Atlanta.
Neil, thanks so much. Really appreciate your time.
And to our listening audience, if you like what you hear, hit that like button and share. We'll see you next time on the show.
Thank you for listening to Expert Profiles Atlanta with Neil Howe. To learn more about the resources in the show or to listen to past episodes, visit expertprofilesatlanta.com.